Abortion rights in Texas are some of the most contentious in the US.
Abortion is violent!
Even before Roe v. Wade was overturned, most procedures after 6 weeks were banned, with no exceptions for rape or incest. And it was a Texas federal judge who recently tried to suspend the use of a popular abortion drug, not just in the Lone Star State, but across the country. An intervention by the Biden administration means currently the drug is still largely available, but the legal row has now reached the highest court in the US, with a decision on its use expected tomorrow.
It's infuriating, it's confusing, it's fearful. People are fearful right now about what they're doing, what they're having to do in order to get basic health care.
Mifepristone is one of the main abortion drugs in the US and can be used during the first 10 weeks of pregnancy. Campaigners who offer advice about abortion pills say the drugs are essential for women living in states where the provision of abortion care is banned, but where self-managed abortions are not technically illegal.
They are pills that are mailed directly to their homes, and people are using them to have a medically safe, self-managed abortion in the privacy of their own home or space. So it is a lifeline.
It was a group of anti-abortion doctors who brought the case against Mifepristone, saying the goal was to protect American women and girls from dangerous chemical abortion drugs. Now, despite the medication being approved more than 2 decades ago, a Texas judge ruled that the Food and Drug Administration, or the FDA, had rushed the process, that they didn't consider the side effects properly. But many medical experts disagree.
So we have decades of safety data on this medication. It is safe to use for nearly everyone. It's the preferred choice for many pregnant patients who are hoping to end their pregnancy. It's used for miscarriage management as well. So I would say it's undoubtedly a very safe medication. And this really comes across as a political decision and not a medical or evidence-based decision.
This comes nearly a year since the Roe v. Wade ruling, which guaranteed women the right to an abortion, was overturned, and individual states have the power to decide. Currently, most abortions are banned in 13 states, including Texas. Florida was once a destination for those seeking the procedure in the South, but now a 6-week ban is expected to be brought in, with victims of rape and incest required to provide proof.
These are unborn babies that have heartbeat, they can feel pain, they can suck their thumb, and to say that the state constitution mandates things like dismemberment abortions, I just don't think that's the proper interpretation.
Medication abortions have to take place with a physician present in Florida. If the Supreme Court decides to allow restrictions on Mifepristone, Dr. Rapkin says it will have a profound effect on services.
We will have to cease providing medication abortions altogether, at least for a while we completely restructure our processes. Medication abortion will no longer be a legal option to patients here in Florida, forcing patients to undergo a procedure that they hadn't planned on, travel farther to access an abortion, or continue a pregnancy against their will.
If the conservative-leaning Supreme Court sides with the Texas ruling, it could significantly limit access to Mifepristone. But there are legal opinions which suggest it may not be binding across the country, though much is still unknown. The future of US abortion access lies in the hands of its highest court.